My name is Dr. Alif Kar, and I'm the consultant orthopedic surgeon in the Penang Adventist Hospital. And my specialty is in arthroplasties. There are many forms of arthritis, and one of the most commonest is osteoarthritis. Osteoarthritis comes from the two words, osteo and arthritis. Osteo meaning that the bone, and arthritis means the joint. So whenever there is any dysfunction of a joint, there is osteoarthritis. Basically what it means is that the cushion or the cartilage that cushioning the joint gets destroyed or damaged. Okay, the knee osteoarthritis is caused by many factors. One of the most common factor is obesity. Right? Obesity causes osteoarthritis of the knee, and it is one of the most common that we see in the clinic. If you can divide osteoarthritis, it can be primary or secondary osteoarthritis. Primary osteoarthritis means we don't know what the cause of it. Suddenly it just happens. It might be old age, it might be genetics, it might be obesity. But when we talk about secondary osteoarthritis, it's caused by an accident on the knee joint, or sports injury on the knee joint, or any other injuries that cause damage to the cartilage lining. So that's secondary osteoarthritis. So primary and osteoarthritis are the main causes of osteoarthritis of knee joint, but of all these, obesity is one of the main factors. There are many symptoms. One of the most common which will bring the patient to the hospital is pain. Pain at the knee joint, pain, swelling, stiffness, especially in the mornings when they get up, stiffness in the joints. They also get redness at the area where the pain is, and that will be leading to loss of function. So these are the things that will make the patient come to the hospital when they have osteoarthritis of the knee. There are many forms of non-surgical treatment. The first thing is we need to diagnose. One of the best ways or the easiest way is to do an X-ray. If you look at the screen of my computer here, you can see these are X-rays of a patient with osteoarthritis of both knees. So you can see how severe the damaging of the joint is. So we'll do an X-ray and we'll confirm that it's osteoarthritis. Once we have done that, we will start him with some medication like glucosamine. Glucosamine is not a very good method of treating, as it's only effective in 2 or 3% of cases. The next thing we will do is to inject hyaluronic acid. Hyaluronic acid is a component normally found in our synovial joint, and as we grow older, hyaluronic acid component of the synovial fluid gets lesser and lesser. So we inject into the knee joint the hyaluronic acid, which will last for about 6 to 8 months, and the patient will start having pain again. We also give some non-steroidal anti-inflammatory, which is a painkiller, but it's not advisable in the elderly as it causes a lot of kidney problems. So in the end, if the non-surgical treatment fails, patient will need to do surgery, which is the actual treatment for osteoarthritis. Okay, the surgery is called a total knee replacement, which is actually not replacing the whole knee. It's just by putting the implants here. As you can see in this model here, it's made of titanium and cobalt chrome. So what we do is we put this insert into the two joints so that when the patient walks, the two bones don't meet each other. So when the two bones don't meet each other, there's no pain, and patient is able to do their activities of daily living as before. Yeah, the main thing is to take care of your knees. One of the ways to take care of the knees is weight control, obesity. Do not be overweight, as this will put a lot of pressure on your knees and you will end up with osteoarthritis. Secondly is those involving in sports. Make sure that you have proper warm-up before you do any sporting activities. Make sure you have a proper activities which do not involve extreme sports which will damage or harm your knee joint. Because once you harm or damage your knee joint, it will end up with osteoarthritis.